Well, uterine fibroids can cause significant symptoms for women, and in the past, doctors would recommend a hysterectomy. But now, there's a much simpler procedure that only leaves a tiny, itsy-bitsy dot on the wrist, believe it or not. Dr. Hardee with Texas Endovascular is here along with patient Kiwanna. Simon, welcome to you both. And I just saw your polka dot. Like, yes. It's really, really, really tiny. This is fascinating. I mean, you just don't think of something that's going on in the uterus being healed by the wrist. We've heard of this through heart procedures, but what happens here?
Well, basically, uterine fibroid embolization is an outpatient procedure, non-surgical, where you shut the blood flow down to fibroids. Fibroids are very vascular. They require blood to grow and survive. Thread a very tiny catheter through their arteries in the body, find the uterine arteries, and inject these little tiny particles that permanently block the blood flow to the fibroids specifically. Fibroid shrivel up symptoms are typically gone in about 3 months. And people can get pregnant after this. We ask them to wait about 3 or 4 months.
Wow, that is incredible. How were fibroids affecting you before your procedure?
Oh, fibroids, I couldn't do a lot of workouts. I had so much pain, so much pressure. Monthly, it was just a lot of pain with it, really. It just limited me in a lot of ways, and now I just don't have to worry about that.
That is incredible. So you had the procedure through your wrist, yes, to get rid of those fibroids. How long did it take for you to start feeling better?
I mean, after the first 24 hours, I felt better, and I hadn't had any complications since then. I mean, I didn't even have complications. It was just like elevated cramps. But after that, I was good to go.
And then you got pregnant and had a baby.
Yep, 5 months later.
That is huge.
Yes.
That is unbelievable. And so pregnancy is often a problem for someone who does have fibroids and don't get them treated?
Absolutely. Multiple fibroids is a very common cause of infertility. And for some ladies, myomectomy, where you remove individual fibroids, is a good option if you have 1 or 2 fibroids. Kiwanna had 24 fibroids, so not really a good myomectomy candidate. So uterine fibroid embolization, we're able to treat all the fibroids at the same time and allowing her to become pregnant down the road.
Wow, it is incredible. And then you were one of the first in Texas to start this. What were you doing before? Because I understand when you go through the growing, like what was typical, that you can have more complications. It just takes longer.
Right. I've been doing this about 25 years, and groin access was typically what most people did. And about 11 years ago, my partner, Dr. Fox, and I started doing it through the wrist. Probably one of the first in Texas, definitely one of the first in Texas on an outpatient basis, treating it through the wrist. Much more comfortable for the patient. They get to go home much quicker, and it has much lower bleeding complications compared to groin access.
It is incredible. Who's the ideal candidate for this? Can everybody do this if they have fibroids?
Well, this is for women with symptomatic fibroids. Only about 40% of women have symptoms. So if you have symptoms, heavy bleeding, pelvic pain, bulk-related symptoms like urinary frequency, uterine fibroid embolization is a very good option to get rid of those symptoms without having to go through surgery.
And Kiwanna said she didn't really have any significant side effects. Is that what you typically see with your patients?
You can have cramping for several days afterwards that we control different pain medications, but most women are back to work, back to normal activity around 7 days afterwards.
And who typically gets fibroids? Is there somebody who's more at risk of them than others?
All women are at risk for them, but African American women especially. 80% by the age of 50 will have fibroids, whereas Caucasian women around 70% by the age of 50. But all women can get fibroids, and about 40% become symptomatic in their lifetime.
Well, it's fascinating to know that there is this option that was just so easy in, easy out, and your daughter's just as healthy as can be now, and it's all good.
Yes.
Thank you for coming in, Kiwanna, to share your testimony. I'm so happy to hear what you're doing. Thanks for sharing.